So I will talk to you about health data at a very different level. So my presentation focuses on what we call the health economy. So we've been talking about health data and data quality and why we need data to make our life easier from a micro, let's say, perspective. So how we can take clinical data and use it for the benefit of public policy, of people, of population health, and so on. So my discussion will focus more on the macroeconomic data, and specifically, I will speak to you about why we should make a paradigmatic shift in viewing health expenditure and health activity as an investment in society, in the economy, and in the resilience of our systems. So we'll be speaking about what we call the health economy reporting as a policy tool that connects health data to macroeconomic performance, resilience, and at the end of the day, to wealth of our societies. So just a few words about the institution that I'm representing. So I am working with WifOR Institute, that is a global institute headquartered out of Darmstadt, outside of Frankfurt. We have offices in Berlin, Athens, Greece, representations in Boston, Ireland. And what we do is we do impact analysis. So I would like to shift your thinking from just thinking of how we integrate clinical data, from how we can actually look into activity, economic activity related health data, and how we connect these two parts to make good sense out of these things. So at WifOR Institute, what we do is we build a common understanding between different stakeholders by creating a common denominator. So all parties would speak the same language. So what we are actually doing is we're bringing together ministries, political stakeholders, statistical institutes to talk about the data using the same language, meaning the same things. Now, why do we need to invest in this high quality data? This is the question. It's blocked, so you cannot see this question. So recently, through the COVID crisis, we did get a live confirmation of how all economic activities, thank you so much, Maria, how all economic activity is interrelated and affected by health. So disruption, we noticed, was across all economic and social activity, and we all have discussed this. And although this is a reality, health data is not collected in a way that allows measurements of how health affects economic and social performance to that end. An obvious question that comes up is how we fix something if we don't measure it. So data is there so we can measure something that we are willing at the end of the day to try to fix. Now, the answer to this question is that you simply can't fix something if you don't measure it. So smart policies actually are made only if we measure things reliably. And this is what health economy reporting is all about. It's about measuring how health-related activity in our economies, regional, national, or global economies, affects the macroeconomy. Oops. How is this thing moving? Oh, it's not moving now. Excuse me?
That should be okay.
Yes, thank you so much. So how could reliable data collection benefit healthcare providers and policymakers? So without any question, there's a financial dimension of health metrics, health data, and therefore quality should be accounted for if we want to make the right and the smart decisions. So we need reliable data that connect health interventions with their impact. If we do not capture the value of the impact, we really have a very limited viewpoint of what is happening. So this is what is missing in our policy-making processes at all levels of governance, local governments, regional and national governments. So all those scarce societal resources in countries are directed to health interventions. We don't know the return of investments of those interventions. So how can we make the right decisions if we don't know how a policy, how and what is affected by a policy? On the one hand, healthcare providers, healthcare systems, let's say, hospitals and so on, need to prioritize their actions. And on the other hand, economic policy making would be deficient if they do not account for the health parameter. So we're proposing globally for a consolidated economic and health policy with common goals, and this is the missing link, and why we need to have reliable data in order to make these smart decisions. So what's this new perspective? You know, we have been seeing that health expenditures typically have been viewed as a cost, as a political cost actually, and not as an investment for sustainable growth and development. And although 80% of these expenditures for health come from pooled sources, we actually still view it as a cost. So one stakeholder is trying to grab money from the other. And this is a story. So I have, people in health systems actually live this tragedy on their daily lives. So what we are doing at WifOR, we're fostering the paradigm shift in healthcare from a cost factor to a driver for growth, for innovation, for wealth, for prosperity, and at the end, for better health for the population. And we are viewing health economy as a driver for all these aspects. Now, what is the health economy? Think of the health economy as a diverse industrial sector that is comprised by any economic activity, as we see this in the national accounting systems, but both regionally and nationally, that is contributing to healthcare. So we see three big parts. I'm not going to stick on this analysis, but there are three major parts. We have the healthcare economy, typically what we have is hospitals, healthcare practitioners, and so on. Then we have the industrial health economy, that is the pharma industry, medtech, R&D, and so on. And we have all the service and support industries, retail, health tourism, IT, private insurance, and so on, that goes into the healthcare provision service. Just to get an idea of what the health economy is all about globally. So you'll be shocked. The health economy is contributing 7.6% to global GDP as an industrial sector. We're talking about $6.3 trillion, and this is twice the GDP of France. So it's a big sector. And in terms of employment, it is contributing 5.7% of the global employment, and this is something less than 200 million people working in this sector. So that's like the labor force of the United States and Canada together. So we're talking about very powerful industrial sectors. Whatever we do, whatever we speak about, is very aligned with what WHO, that we're closely collaborating with, is doing. So we believe that health economy has a very essential social and economic role, and it has a positive impact on the economic performance of other sectors. So what €1, $1, £1 spent in a regional economy does to another sector, mining sector, automobile sector, tourism, is actually what we need to measure, to monitor. And for this reason, we need this reliable data. So we need to structure databases, as we have been doing for the past 12 years with the Federal Republic of Germany, throughout all the regional governments as well. This is a very simple, however, very insightful graph. This is time series of health expenditures and global GDP growth rates as a percentage of GDP. So what you see here is that during the crisis, 2008, 2009, during the pandemic crisis, at 220, we saw a collapse at GDP growth rates. Okay, but what happens when the global current health expenditure as a proxy to the health economy grows? Then with a time lag, you see growth rates picking up. This tells all the story. I think, whoops, sorry. This is all the story to be told. I was honored to be a co-author for a paper recently that we presented at the G20 presidency, along with my WifOR colleagues and Professor Rifata Tun and other distinguished colleagues. So we entitled this paper, "If we can't measure it, we can't fix it." What is it all about? This is available, by the way, and I can make my presentation available to everyone. There's a link there and you can see this paper. It's a very simplified way that speaks about how we assess at all levels, and I will be very specific in half a minute, of health investments, health interventions. So we need data in order to be able to calculate returns of investment. And if we have these returns of investment, only then we can make smart decisions. So this is a simplified view of our 5-step framework of how to assess impacts of health investment. So health investment, siloed, just sitting there in itself, doesn't say much. A health investment should be viewed in terms of its impact. And the impact of the health investment is the return of investment to the economy, to society, and to the environment. So I'll show you in a few minutes what we're doing on that side, on integrating these 3 factors that I just mentioned. So the first stage, by the way, all these stages are connected with SDG goals. So you see SDG 8, 13, and 3 in my table. So the first step is to have this macro picture of what is the health economy? What is all the economic activity measured in GDP, gross value added terms, and employment that is contributing to society by the activities that cater to health at the overall sense. So once we know that, we know the size and we know what's going on. We have a structure. So this is the data, the first big macro data structure that we need to set in place. Second stage is we're looking into the interlinkages between the health economy subsectors themselves. What happens if we pump £1 into the health system of Wales, let's say in your case? 2 minutes, can I have 4 minutes?
Yeah.
Thank you, because I'm negotiating. So I'll wrap it up, so yeah, sure. So interlinkages within the health economy. What happens if we put £1 to one sector with another sector, with a pharma sector, let's say, and so on? What are the spillover effects beyond the health economy? What happens to mining, to automobile industry, to tourism, to banking, and so on? What happens with the climate impact? Because there's both ways relationship of climate and health burdens in societies. And at the end, we have this microeconomic approach is what is the social impact of a specific intervention in terms of GVA and employment. So let me just rush it through now. So at the center of all the discussion is SDG 3, better health for all people. And this is connected, as we saw, with all other goals in our view. Now, recently, we measured the contribution of the medtech industry of the fellow German state. So what we did is we saw how the medtech industry contributes in terms of social, environmental, and economic terms to the local, national, and global supply chains. So this set the precedence for a new benchmarking of how to measure the contribution of a health system, of an industry, of a company. Okay, so this is setting the new. It is instigating a new paradigmatic shift in viewing these expenditures and this activity in a different viewpoint. Just to give you, for Germany, every 8 euro produced is part of the health economy, and every 6th job is part of the health economy. It's big, it's powerful. These are the numbers for the European Union, 9.6 and 12.5. All your indices should have been benchmarked with this if you're related to health in any way. That's my suggestion. These are just some statistics of our recent calculations for Germany. So we're talking about 390 billion euros per year for the health economy. And these are the health economy shares, just to get an idea of various countries. So you see there's a big spread. Other countries pump in money, others don't. And we see the results. The benefits. Well, the benefits is that we have a starting point for a new objective dialogue between all stakeholders. We have an evidence-based insight and monitoring to support decision-making of economic and health policy jointly, and I'm emphasizing this. We can have comparability with other important sectors of the economy because we're measuring everything in terms of gross value added, GDP, and employment. And we also can see for industry the social, economic, and environmental assessments. And this is a macroeconomic approach of the future that can give us that can support and give value-based policy decisions. And again, we are reframing health expenditure as an investment, starting from strengthening growth, stability, and so on, strengthening the value chain of the health system itself, generating positive effects for the overall economy, at the end, improving healthcare. I mean, this is a win, 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 win. And as Dr. Jakob of the WHO says, I love this, is, health investment is the smartest investment. Why? It just pays off. That's why it pays off society, to growth, and to everything else. Thank you so much for your attention, and I'm open to any of your questions. I held it 4 minutes, I guess.
Just a little bit on that.
Thank you.